This is In the Loop. I'm Christian Bryant. We're continuing to unpack the wide-ranging impacts of the Supreme Court overturning Roe v. Wade.
What do we want? Abortion rights! Hands off my body!
Protesters on both sides of the abortion debate took to the streets over the weekend after the Supreme Court handed down its ruling in Dobbs v. Jackson. It eliminated the federal right to abortion and gave states the power to decide the issue. With abortion trigger laws on the books, 13 states are fast-tracking abortion bans. The laws have already taken effect in 5 of those states, with the rest expected to take effect within the next few months. Alabama, which did not have a trigger law, has also banned abortion. Unless abortion seekers in those states are able to travel elsewhere or access medication abortions, they will be forced to carry their pregnancies to term or seek out medically unsupervised abortions. Abortion has long been treated as a culture war issue, but efforts to ban it can often overlook the medical aspects of the procedure. Both pregnancy and birth are considered medical conditions. Even so-called normal pregnancies are not risk-free. The most recent CDC data from the year 2020 shows the maternal mortality rate in the US is at more than 23 deaths per 100,000 births.
Compared with other industrialized countries, the United States ranks very low when it comes to maternal mortality.
Dr. Madeline Sutton, a board-certified OBGYN in Atlanta and a former CDC researcher, told us the numbers can differ widely along racial and regional lines. More than 55 Black women die per every 100,000 live births, nearly 3 times the rate for white women. Data from states that report racial and ethnic splits on abortion show that Black women seek out abortion at higher rates.
No matter how many years, when you go back decades and we look at the data, Black or African American and brown and or Hispanic women tend to do worse when you compare them to their non-Hispanic peers.
Some southern states with strict abortion laws have some of the highest maternal mortality rates in the nation. In Louisiana, where the governor signed a bill in June to strengthen the state's abortion trigger law and criminalize providing an abortion, the maternal mortality rate has climbed as high as 77 deaths per 100,000 live births in the last few years. In Georgia, that rate is 66 per 100,000, and the state is in court fighting to implement a ban on abortions after 6 weeks of pregnancy, before most people even know that they're pregnant. And with abortion no longer an option in the states where it's banned, we wanted to see if there were more resources available instead for people who do carry pregnancies to term. Well, out of the 13 states with abortion trigger laws in the books, none of them require paid family leave for pregnant people who give birth, meaning that those who rely on their employer for insurance coverage could lose healthcare access if they need time off after giving birth. As for affordable healthcare, it's a mixed bag. 8 states with trigger laws have expanded Medicaid access, while 5, Mississippi, South Dakota, Tennessee, Texas, and Wyoming, have not. Even people who have access to care and want to carry their pregnancies to term could be negatively affected by certain abortion bans. Take ectopic pregnancies as an example. These occur when a sperm fertilizes an egg, but the egg grows outside the uterus instead of inside it. The March of Dimes estimates that about 2% of pregnancies are ectopic, and in all of those cases, it is impossible for the fetus to survive. Amy Allspaw, a certified nurse midwife with a doctoral degree in nursing and an assistant professor at the University of Tennessee, told us it can also be fatal to the pregnant person without treatment.
If an ectopic pregnancy ruptures, it basically kind of bursts the uterine tube open and causes an immense amount of bleeding in the peritoneal cavity, so in the abdomen. And so people can actually die of an ectopic pregnancy. It's the leading cause of death in the first trimester for pregnant people. So it is serious.
Many abortion bans have exceptions for times where the pregnancy jeopardizes the life of the pregnant person, like ectopic pregnancies. And as a reminder, there are a range of physical complications that can come with pregnancy for both the development of the fetus and the person carrying. But that's been a target for politicians opposing abortion access. Oklahoma passed a near total abortion ban with an exception for ectopic pregnancies, but during debate on the bill, State Senator Warren Hamilton voiced his opposition to that exception.
But a child who is, in fact, living out part of his or her early life as the unfortunate circumstance of being an ectopic pregnancy, is in fact still a unique human being with its own DNA. And I wonder, I guess I just don't understand why we've created an exception where we allow those children to be murdered, but not the others.
And although that effort to target exceptions for ectopic pregnancies didn't succeed, many abortion bans, as currently written, could create uncertainty for doctors and other healthcare providers.
So if, for example, they were to say you couldn't do anything once either fertilization or implantation has happened, which both have already occurred by the time you have an ectopic pregnancy, then you're going to tie clinicians' hands in terms of how they can treat this life-threatening condition that people don't usually die of in the United States, but can if there are laws that specifically bar treating, like ending a pregnancy after implantation or fertilization, or if clinicians aren't sure and they don't know what to do. And I think that sometimes is the more salient part.